you will apply smoke or you will heat it. So Ushna is the Chisa or Kapha. If you want to preserve the pumpkin as such now, you will put in the refrigerator. Sida is the treatment for Pitta. And if someone will give you a dry pumpkin and you ask you to eat, you cannot eat it as such. So you may have to dip it in ghee or you may have to dip it in some oily substance or water. You have to make it drava and eat. So snigdha is the treatment for vada. So like this, you can take a lot of examples. I just use this to teach my students that to see dosha in everything. You cannot outrightly compare rheumatoid arthritis is equal to vada rakta or amavada. That's not correct. In some patients, rheumatoid arthritis may be amavada. In some patients, rheumatoid arthritis may be vada rakta. It always depends upon up to which dosha level the disease process has gone into and what is the dosha prevalence at a given point of time. So this we have to keep in mind. So let us see how modern science looks at the pumpkin's various stages. So pumpkin fruit gradually accumulates considerable amounts of dry matter, total soluble solids, total sugars. So this is what modern science says about the changes that happens to pumpkin. But am I audible? Somebody is told that my voice is not clear. Am I audible? Okay, it's clear. Okay. So this is what modern science says. But let's see how Ayurveda approaches this. We may approach it in terms of firmness. That means our panja indriya. So acceptable or not, whether it is soft or not, whether it is sweet, etc., etc. So the same phenomenon is looked upon by different what do you call sciences with a different epistemological approach in a different way. But the thing is that whenever we apply that concept, we should be very pure to our concept. We should not mix it with modern. So usually I tell my students that they have to open two shelves in their brain. One is for modern and one is for Ayurveda. And there should not be any, what do you call it, pathways in between. Because once there is a pathway between modern and Ayurvedic concepts, we are going to corrupt our concepts and corrupt our practice. So dosha assessment dosha assessment is very important, especially whenever we want to generate prescriptions. So I'll just give you an example of how we can assess dosha in Kushta because it's very easy to show photographs. See, Parushya, Karabhava, Shyavarunatvam. So all these things are features of Vada predominance in a Kushta. That doesn't mean that this will stay as such during the course of the illness. So that whenever you start applying the oil, this Parushya will go off and maybe the Pitta predominance will happen next. So then you may have to stop the oil and you may have to go for Nalpamara, Kashaya, Dhara, etc. So this concept should be there in our mind that the doshavastha can vary between different individuals. The doshavastha can vary between different time points in the same individual based on his food habits, based on the seasons. So there are a lot of things that can happen during the course of the illness. See, Rauksham, Shosha, thinning of the skin, Sankoja, contractures. So all these things indicates Vada predominance. You see Raga, Parisrava and Paga. All these things are Pitta predominance. So Kleda, Angapadana, all these things indicates Pitta predominance. You look at the Shveda Varnada, Styrium, Utsedam, elevated lesions. All these things indicates Kapha predominance. See again Sneha, Kleda, Jandu, Krimi, etc. indicates Kapha predominance. So this is how you identify dosha predominance. So whenever you identify the dosha, always as I told earlier in the example of Shula, look for initiating dosha. Who is the initiating factor? For example, we get a lot of patients with acidity. There are two possibilities. One is just from now onwards, you start asking the individuals about whether they have any arshas or hemorrhoids, whether they have any abdominal distension. So whenever there is arshas, there can be abana vaigunya, and this abana can become udavarta, and this upcoming vada will take pitta upwards. So in such scenario, a pittahara medicine will not give relief, but a vadanulomana and arshohara treatment will give relief for the amlavita. But this may not be the case in another individual where the amlavita is triggered by the pitta itself, where you will give pittahara medicines and you will get result. So depending upon the nidana and specific pathology that is going on in the patient, you look for the initiating dosha, you look for the modifying dosha. For example, Shula is Vada, but you see, I have told you already there is Kafaja Shula. So in such a scenario, Vada is mandatory for producing the Shula, but who is the modifying factor? Kapha is the modifying factor. So in such a scenario, you may have to give Kaphahara medicines. So for identifying the dosha, you can use so many what you call strategies. For example, time of the day when the pain is more, uh, timing with related to food habits, or seasonal variations in the manifestation. The body part affected. For example, even in Shula, Ajara says in the upper abdomen it is usually Pitta Kapha in nature. In the mid abdomen it is usually Pitta in nature, and the lower abdomen it is usually Vada Pitta in nature. So like that he has told. So this reference is from Susura Samhita. So like this you can look at the body part that is affected. For example, you got a patient with cervical spondylosis. I have seen a lot of Ayurvedic doctors, they immediately start applying oil on the neck. This is very wrong because the Sthanika dosha is always Kapha. So you should always go for giving something Ruksha there, Ruksha Sweda, etc. there, before starting to apply oil. So what Susra says, Vaksha Triga Skandagadam Vayu, Manyagadam Dada, Vamanam Handi, Nasyam Ja, Ruksha Swedam Ja Prayojita. So in Vaksha, Skanda and Manya, etc. Pradesha, even in Vadavyadi Chikitsa Adhikara, he says about Kaphahara Chikitsa. So usually we tend to forget all these things. So the body part affected is again very, very important. And also you can take clues from Nana Atmaja Vigaras to identify which is the dosha predominance. And you can also do another approach. You can quantify the lakshanas. For example, if the patient told 10 Pitta lakshanas and 9 Vada lakshanas and 3 Kapha lakshanas, then you can identify it is a Pitta Vada predominant condition. So like that, you can look at the percentage of the lakshanas. And sometimes what happens, you may have to give weightage for one of the lakshanas. For example, a patient came to you with jwara, and 5 features are there for kapha. But the predominant one is that there is irregularity in the onset and what you call increase in temperature. So that irregularity itself indicates vada. So you have to give extra marks for that vada way. So sometimes you may have to give weightage for some of the troublesome lakshanas. Then after identifying these, then you should consider about avarana or samsarga, then taratama of the lakshanas, anshamsha of the lakshanas. For example, in case of taratama veda, if it is pitta kapha predominant, then it is guluchadi kashaya. So in guluchadi, it's told pitta kapha veda. If it is kapha pitta predominant, then padola adhigana. So there can be subtle changes in the prescriptions. So usually what happens is we will prescribe a lot of drugs. We will take too much time to treat a patient. And after some prolonged period, you will get a result. Because we are always going with a trial and error method. But instead of that, if you go for that Sukshma assessment, then the initial prescription itself will give you immense results. Suppose a patient came to you with a kushta and the kapha, there is pitta kapha predominance, then you give guluchi adhikashaya. But another patient says, I have more itching than burning sensation. Then it is kapha pitta. You give padola, you will get immediate result. So like this taradama assessment is very, very important. Then you should also assess amshamsha kalpana. This is again very important in case of disease like Vadavyadi. For example, if it is a Stamba Pradhana Vadavyadi, the Ruksha Sida Gunas are more predominant. Then you will select a Kaya Sega or Pirichil for that condition. But if it is a Shosha Pradhana Vadavyadi, then Laghu Ruksha Amsha of Vada is predominant. Then you do Shashtika Swela. We have seen in a lot of Ayurvedic institutions what they will do. Whenever they get a Paksha Gada, they will admit the patient. Then they will start Ruksha Sweda. Then they will go for Pirichil. Then they will go for Shashtika Sweda. And they will discharge the patient, irrespective of what is going on in the patient. So this is actually irrational prescription. If you know that the spasticity is more, you will never go for a Shashtika Sweda because it is Dhardikrit. It causes more Dridatva. If flaccidity is more, then you can know it is Dosha Pradhana, then you can go for Shashtika Sveda. But if Stamba is more, spasticity is more, then you will always opt for Kaya Seva. So, such a what you call minute assessment is very important whenever you start planning the treatment. Anything to discuss in these areas, or else we can go for. If anything is there, you can please unmute and we can ask. or if there are some contrary opinions, again, I am always willing for inputs from you as well. So if there are some conflicting opinions also, you can unmute and we can discuss. Okay, I think there is no. Are you all people there, or?
Yes, sir. Yes.
Yes. Continue. Okay. So now see, during a timeline of a disease, during the course of the disease also, the doshavastha can vary. You look at this patient with bronchitis. In the first week, the patient in the first visit had cough, profuse yellow sputum, and fever. Okay, so you can see that this is a pitta predominant stage. Now, what happened? The next is the patient in the second visit when the patient came. The patient had cough, chest pain, and thick and clear sputum, and less appetite. So it is a kapha-vata feature. Now, in the third stage of third visit, the patient had cough, dry, and thin sputum. Again, it is vata predominant. So you cannot just say you take Desamula Kadatura Kashaya for months together. That's not possible because you can see even we are manipulators. We give medicines to manipulate the doshavastha in the patient's body. So this is what I told about everything about the dynamic assessment. Charaka even says that muhur muhuscha roganam avasthana madhurasya. So we have to repeatedly assess the patient. The doshavastha may vary repeatedly, so you have to modify your prescriptions accordingly as well. That's very important. So this is a case just to identify why this dosha predominance is very important. So this was a case of maturity onset diabetes of the young. So this is a male patient, a 24-year-old male patient. See, look at the fasting blood sugar; it's around 351. Okay, and the patient is not under any modern medicines, and he came to our Ayurveda college. So we did a treated. We identified that it is a pitta vada pradhana prameha, and see, you look at the prescriptions. We initially gave a pittahara medicine in the form of pitta kashaya, etc. And then we targeted the Medo Dhatu with Asanadikana, and the Vada predominance we gave Dhanvantara Grida. I don't think many of the Ayurvedic doctors will start prescribing Grida in a patient with a diabetes, but we assessed that it is a Vada predominant one, and we started Dhanvantara Grida. And you can see without any modern medicines, after a period of, so I think this is in May 2017, this is April 2018. You can see the blood sugar is totally normal within 1 year. It's not 1 year, the patient started improving within 3 months of the onset of the treatment. Just I wanted to show you the result after 1 year of the therapy. So this is the importance of. So here usually when we get the prameha, what will be our usual prescription? Whenever we get diabetes, what will be our usual prescription? Can you please post in the chat box? Notwithstanding what I have told now. Yeah, Nisha Malagi. Then we write Chandraprabha, isn't it? So usually Kada Gadiradi, Nisha Kada Gadis, yes. But we didn't use any of these drugs in this patient because see, so that's what we have to assess the condition. We have to assess the dosha predominance in the given patient. Then we have to prescribe. This is another thing. Usually we get a lot of patients with hypothyroidism, and people will tend to write Kanjara in every patient with hypothyroidism, thinking that it is goiter. But you look at this patient, the pitta vada predominant presentation was there. The patient had full burning sensation, etc. And we gave drakshadi vada and pitta grida, and the patient became okay. The TSH, everything became normal. But the common prescription usually the people do is Varanadi Kashaya, Kanjara Rogulina. This is that modern mentality. Hypothyroidism is equal to Kanjara Rogula and Varanadi Kashaya. So that should not be the case. This is another patient with hypothyroidism where the patient was exposed to Abhishanti Ahara like Dadi, etc. And the predominant presentation was Kaphavitta Pradhana presentation. So then what we did is what we did here is the we identified that this is kapha pitta predominant, and we gave kapha pitta treatment, and the patient responded. We look at another condition where we suspected avarana. So this is a patient with cervical myelopathy, and the patient was quadriplegic when the patient came to our hospital. And this is what the patient was evaluated on a modern facility, and they have diagnosed it as cervical myelopathy. So our indicators were that the patient had madhumeha and medha kapha avarana, which resulted in sarvangavada. So what we did is we went for Udvartana etc. treatments, and we gave Erandamula the Yabanavasti for 15 days, and following which we started the patient on Leshuna Rasayana. So after 1 month of the therapy, the patient went home in a wheelchair, and after 2 months the patient started walking with the support, and now the patient walks without any support. You should remember that the patient was quadriplegic. Identifying, but we cannot say that every cervical myelopathy is avarana. No. In the given patient, because of the evidences of avarana was present in the given patient, we gave such a treatment. So we cannot generalize that in every cervical myelopathy, Leshuna Rasayana treatment. That's not pure Ayurvedic approach. This is another case of quadriparesis. Again, this is also a condition of CIDP, chronic inflammatory demyelinating polyneuropathy. The patient was initially evaluated at the Thrissur Medical College, and there were sensory involvement. And again, we diagnosed it as kapha avarana, and the patient had kapha vada pravritti, and with a good Agni bala. And again, the patient was treated with all those Shodhana therapies like Vasti, and finally the patient was put under Chitraga Rasayana. And after the Chitraga Rasayana, the motor symptoms completely resolved. The patient started walking on without any support. Only thing remained was sensory symptom, for which the patient is still under our follow-up. But the thing is that here also we identified it as avarana. We didn't give any Thaila, Kaya Seka, etc. or even Shastika Smeta, etc. Nothing was given in this patient. So that is regarding the dosha vishesha. Some of the finer aspects that we have to identify whenever we discuss the dosha vishesha. Hope I am not going very fast. If you want to slow me down, you can tell me. If you want to discuss anything regarding what we have seen now, you can unmute and discuss. Otherwise, we can go forward.
In Madhumeha also the doshavastas will change from time to time, sir.
Definitely.
Whether we need to
change
the treatment line.
Definitely, it will change. That is why I am telling a pattern oriented method, like in every prameha nishama, like your Katha Gadarati. There is a typical stage in which we have to prescribe Katha Gadarati. So that stage is very important. So we should identify what is the underlying pathogenic process that's going on. So the basic problem that happens to us is that we tend to identify the samprati that is told in the textbook, and we apply that in the patient. That should not be the way. We have to identify what is the samprati in the given patient. So whatever samprati is told in the textbook is only what you call to guide you to guide your thinking process.
Okay.
But in every given patient, we have to identify which is a samprati that is going on.
Sir, and first prescription will be for how many days, sir? Means
so that's what. See, our therapy should be basically target oriented. So whenever we prescribe, there should be clear-cut target in our mind. What is our target with this prescription? For example, a patient came to me with features of Amalavitta and low back pain. So we know that almost all Shulahara Kashayas are very Ushna and Tikshna. So I cannot give that in the patient. So maybe initially I will give the patient a Guluchiyadi Kashaya and Avipatti Churna. So my target is that I will tell the patient, see, I am not prescribing for your pain now. For that, I will give you an oil for applying. But I have to correct your GIT first. So this is what my prescription is. And you come after 2 weeks or 3 weeks, depending upon the chronicity of the illness. So my target there is now the reduction in the pitta in the koshta. So after that, I will switch the medicine. So like this, for every prescription and for every external therapies, we should have clear-cut targets in our mind. And once we achieve that target, we have to alter the treatment. Sometimes what happens, even after giving the measure for 3 weeks, there will not be any change. Then also you have to switch because that medicine is not fit for the patient. So I think a prescription can go up to 2 or 3 weeks, then you can switch the medicine.
Okay, sir. Thank you.
Sir, what is the relation of emotion factors in Madhumeha, sir? Does it affect on the sugar levels?
Definitely it will affect. Definitely it will affect because emotional stress always increases the what you call glycemic level, the glucose level in the body. So there is a definite relation.
In that treatment line?
In the treatment line, you have to give some what you call Tikta Pradhana medicines, which has action on Manas. Because for Manas, we have basically, you look at all the medicines that act on mind. Basically, they are either Madhura Pradhana or Tikta Pradhana. So in Prameha, you should go for Tikta Pradhana medicines.
Okay, sir. Thank you.
Somebody asked more about dosha avarana. Can you please unmute and ask what is your specific doubt about avarana? Dr. Neha, I think.
Yes, sir.
Please.
Sir, sometimes we confuse which dosas.
Yeah.
How
So,
I can explain?
so basically what happens is avarana can happen to any dosha. If you look at the Udara Chikilsa Charaga, Chakravani commentary, even he says kapha over the pitta, pitta over the kapha, etc.
Yeah.
But clinically what happens is, clinically avarana is only
Yes.
important for vada. So I will give you a scenario. You got a patient, a 60-year-old male patient who is obese and who underwent Sandarpana throughout his life, and he got a stroke, hemiplegia. And now, what might be the cause, whether avarana or dhatushaya?
It may be Dhatushaya.
No, there is no possibility of dhatushaya in a patient who underwent Sandarpana. Because the evidence itself says that the patient is obese, the patient is kapha metho predominant, and the patient underwent Sandarpana throughout the lifetime. Definitely, there is no chance of dhatushaya. That's what the people will tend to confuse. Hemorrhage dhatushaya. In fact, that is the rubbish, absurd. That's not like that. Even hemorrhage will present as avarana. So, only thing is that how we can diagnose avarana. There are only three possibilities. One is from the evidence from Nidana. What are the food habits of the patient for a long term? So, like that from Nidana. Second thing is from the presentation, because two things are there. One is abrupt onset, the other one is fluctuations in the clinical manifestations. These two are characteristic features of avarana. Third thing is upasya. There are only three possibilities to identify avarana in a patient. One is evidence from the Nidana, the second one is the lakshanas, and the third one is upasya. Lot of people will tell Parkinson's is kapha over the vyana. That's not true in every case. There have been a lot of Parkinson's case where I identified it as dhatushaya and we gave mamsarasa and the patient responded. There are Parkinson's patient where there is kapha over the vyana and we gave avarana chikitsa and the patient responded. So that always the decision depends upon the given patient. In this patient, what is going on? So we cannot generalize that. So that is why avarana diagnosis should always depend upon three factors: evidence from the patient's nidana, evidence from the lakshanas, and evidence from the upasya.
Okay, sir.
20 वाली 10 वाली 20 और 20 वाली 2 थे.
So after giving Mrudu Virajana, patient still complains about constipation. So usually here two things can be tried. One is Abhyantara Snehana, or the other one is what you can do is go for Matravasti continuously for some days. Then the patient will get relief. Because this type of constipation happens due to Krura Koshta, that means Vada Prakopa in the Koshta. Okay, so that is regarding the dosha assessment. Now we'll go into the dosha vishesha. So how to identify the dosha vishesha? So there are a lot of possibilities. One is you can go from the direct references from Charaka Sutra 20th chapter, where each dosha lakshanas are told. Asaraddha, Aruji, Asya, Vaidasyam, etc. for Esa, Pushta, Visarpa, Pega, etc. for Ekta, like that. Indirect references can be found in case of respective vyadis in the Chikitsa Adhikara, and assumptions based on Upasya and Anupasya. And there are so many clinicians who say that we can also take inputs from the lab parameters to identify doshas. But personally, I don't support that. I usually rely on the lakshanas in the patient. For example, you take this ichthyosis. So usually ichthyosis, the people will start thinking in the line of kushta, and they give a lot of kushtara medicines, and the patient will not respond because here the culprit is Rasadadu. The Rauksha is happening due to the Rasadadu. You give Pandu Chikitsa, the patient will respond. It's not because I am telling this is Pandu, but the drugs told in Pandu are typically aimed at Rasa and Rakta. Hey, look at this. This is again Rasa and Rakta involved. You can see the Pandutva here. You might have learned about the sloka Pandu Danda Nagoyastu. So this is a typically a patient whose HB level was below 5. The patient is in such a case. You look at this here. There is the dusha is Rekta and Mamsa. You can see the sofa as well as the raga. So here it is Rekta and Mamsa. See here again it is Rekta. Dusha is Rekta. So like this. This is only in the case of skin manifestation I can show you images. But there are so many other situations where we cannot take images. In all those areas, you apply your common sense and you apply the principles that are told in the textbook to identify what is the involved dusha. Why I am telling this is because one modern disease can have different dusha involvement at different periods during the course of the illness. So that is why identifying this is very important. You look at this. This is a patient with what you call muscular dystrophy. You can see the distal muscles are wasted, but the proximal muscles are heavy. So here the dusha is mamsa. Here you can see granthis in different parts of the body. So here the dusha is mamsa and meda. You can see two conditions here. See, one is there are two pedagas. Here the difference is one is a madhumeha rogi and the other one is not madhumeha rogi. And Ajare has told, Vina pramehe piyade jayante dushta medasa. Unless and until you treat the underlying medo dushti, you cannot treat such patients. For example, this patient had multiple courses of antibiotics and still this keeps on coming. And once we did give Medohara medicines, that means Meda Shuddhikara medicines, then the patient stopped having this recurrent lapses. So identifying the underlying dosha is again very important. You take it hypothyroidism because this is the most what you call confusing clinical scenario in our practice. Someone will call it Panduroga, someone will call it what you call Galaganda, a lot of things. But look at the clinical features. You observe the patients properly. What's going on? So here, hypothyroidism is basically Dhadu Gada Agnimandya. So once Rasadadu is involved, the patient will present with fatigue, dry skin, anemia, etc. And next, when the disease starts entering into the Rakta Dhadu, then the patient will have cold intolerance, arterial rashes. Then when the patient starts getting the mamsa involved, then the patient will have muscle aches, weakness, cramps, and even slowly the neck swelling starts coming. Once the mamsa and medo gets affected, you can see a lot of hypothyroid patients without neck swelling. Why? Because the mamsa medo dhadu has not started involving that much. Once this gets involved, then the
खुले तो उसे तोड़ा जाता है। मूर्ति के बारे में जानते थे और अगर नहीं तो कमेंट सेक्शन में जरूर लिखें और हमसे प्रश्न नंबर 5 मक्खी के बगैर सोने से कमर दर्द कम होगा और रीढ़ की हड्डी भी मजबूत होती है। नंबर 6 गाजर का सेवन करने से दिल के मरीजों को फायदा होता है। नंबर 7 ज्यादा ठंडा पानी पीने से हार्ट अटैक का खतरा रहता है। नंबर 8 चावल हमेशा कम खाने चाहिए, इससे विभिन्न बीमारियां होती हैं। नंबर 9 दही के साथ बादाम खाने से भरपूर ताकत मिलती है। नंबर 10 कच्चा खीरा खाना शरीर के लिए लाभदायक होता है। नंबर 1 कब्ज से छुटकारा पाना है तो मोटे आटे की रोटी का सेवन करें। नंबर 2 रोजाना किशमिश का पानी पीने से खून साफ होता है। नंबर 3 भोजन के बाद एक मीठा खाने से पेट संबंधी रोग दूर होते हैं। नंबर 4 दांत पर कच्चे पपीता का रस लगाने से कुछ ही दिनों में दांत ठीक हो जाएगा। नंबर 5 मक्खी के बगैर सोने से कमर दर्द कम होगा और रीढ़ की हड्डी भी मजबूत होती है। नंबर 6 गाजर का सेवन करने से दिल के मरीजों को फायदा होता है। नंबर 7 ज्यादा ठंडा पानी पीने से हार्ट अटैक का खतरा रहता है। नंबर 8 चावल हमेशा कम खाने चाहिए, इससे विभिन्न बीमारियां होती हैं। नंबर 9 दही के साथ बादाम खाने से भरपूर ताकत मिलती है। नंबर 10 कच्चा खीरा खाना शरीर के लिए लाभदायक होता है। नंबर 1 कब्ज से छुटकारा। जो महिलाएं रात में अपने पति के साथ ये 2 काम करती हैं वो महिला अत्यंत भाग्यशाली मानी जाती है। आइए जानते हैं कौन कौन से वह 2 काम हैं। इससे पहले माता रानी जो कोई भी आपके चरणों में लाइक एवं सब्सक्राइब समर्पित करें उसके घर में कभी सुख समृद्धि और वैभव की कमी नहीं होने देना। चलो जानते हैं। ज्योतिष शास्त्र के अनुसार महिलाओं को रात में पति के बाद ही भोजन करना चाहिए, इससे मां लक्ष्मी प्रसन्न होती है। नंबर 2 पति पत्नी को हमेशा पूर्व की ओर पैर करके ही सोना चाहिए, इससे सौभाग्य में वृद्धि हो। तो महिलाएं रात में अपने पति के साथ ये 2 काम करती हैं वो महिला अत्यंत।
हरियाणा के रेवाड़ी जिले से पोते होने की खुशी में बधाई लेने आए किन्नरों को 100 गज का प्लॉट ही गिफ्ट में दे दिया। किन्नरों को मिले इस गिफ्ट की चर्चा पूरे इलाके में हो रही है। दादा शमशेर सिंह पेशे से बड़े जमींदार हैं, उनके पास काफी पुश्तैनी जमीन है। शमशेर सिंह के बेटे प्रवीण यादव पेशे से एडवोकेट है। कुछ समय पहले प्रवीण को पुत्र रत्न की प्राप्ति हुई। प्रवीण यादव की पत्नी ने पहली संतान के रूप में बेटे को जन्म दिया। इस दौरान किन्नर बधाई लेने उनके घर पहुंचे और उन्होंने घर में नाचना गाना शुरू किया। 10 मिनट नाच गाने के बाद किन्नरों ने बधाई मांगी। तुरंत ही दादा शमशेर सिंह ने 100 गज का
100 गज के जमीन दे दिया।
रिकॉर्डिंग हो रहा है, चलो जाओ
100 गज के
जाओ जाओ तो जा रहा हूँ।
किन्नर को 100 गज के जमीन दे
कोई
दिया।
बात नहीं, कोई बात नहीं,
अरे रुकना,
जाओ जल्दी।
100 गज की जमीन दे दिया गिफ्ट में, बताओ।